How do you relieve a pinched nerve in your neck quickly that's sending pain, tingling, or numbness down your arm? In this video, I'm going to show you 5 simple movements that may help to relieve arm pain and calm that pinched nerve in your neck. Now, some people even feel relief within minutes. And make sure you stay to the end because I'm going to give you a bonus stretch that targets a muscle most people with cervical radiculopathy overlook. And it can make a big difference during a flare-up. Let's get started. Hi, I'm Dr. Tam, chiropractor here in San Jose, California. And over 20 years, I have helped hundreds of patients relieve pinched nerves in their neck with this exercise routine. Now, my suggestion is that you follow every exercise in this video in the order I give them because they will target all the areas that are commonly contributing to a pinched nerve in your neck. And they build on each other step by step. But before we start, here are a few important things to keep in mind. Only do the exercises if you feel comfortable. Progress to the next one only if you're ready. Stop if any movement increases your neck pain or the symptoms going down your arm increase. Let's start with exercise number 1, the median nerve floss. The first exercise targets the median nerve, which is one of the most common nerves irritated with a pinched nerve in the neck. When the median nerve is involved, symptoms often travel from the neck into the shoulder, down the front of the arm, into the forearm, and sometimes into the thumb, index, and middle fingers. The median nerve floss helps gently mobilize the nerve and the surrounding tissues, and this may help reduce irritation and improve how the nerve moves through these areas where it may be restricted. It is normal to feel some mild tingling, maybe some numbness, or a light stretching sensation in the arm or hand while performing this exercise. These sensations, they can occur as the nerve begins to move through the areas of adhesion or constriction. These sensations, they should stay mild and comfortable. Only go to your comfort level and do not force the movement. If symptoms significantly increase or travel further down the arm, stop the exercise. Now, this exercise is meant to help take tension off of that median nerve that runs down through here and into the first 3 digits. Okay, so the median nerve floss, super easy to do. Let me show you how. What you're going to do is you're going to take the shoulder and you're going to depress the arm and the shoulder down. And placement of the hand is going to be like this. You're going to take the hand and you're going to point it backwards. Okay, so remember, fingers and hand point backwards, depress the shoulder, and then what you're going to do is you're going to bring the arm out to the side about 45 degrees. So in this position already, I feel a nice deep stretch in that median nerve. So just hold that for a few seconds, let the release happen. So when we start to floss the nerve, what we're going to do is we're going to bend the head to the side, and then we're going to bend the head to the opposite side while we move the hand forward like this, okay? So remember, we're going to bend the head to the side, point the hand back, and then bend the hand to the side and bring the hand forward. So doing this flossing movement of the median nerve, and you're going to feel that release in that nerve, okay? So what you want to do is you want to do about 10 to 12 repetitions. You can do 3 to 5 sets and about 5 to 7 minutes in a day. That's really all you need. Exercise number 2 is the radial nerve floss. Now, when the radial nerve becomes compressed, symptoms often travel from the neck into the shoulders, down the back of the arm and forearm, and sometimes into the back of the hand or thumb. The radial nerve floss gently helps to mobilize the radial nerve as it travels through the shoulder, the arm, and the forearm. Now, this may help reduce irritation and improve how the nerve moves. While performing this exercise, you should feel maybe a light stretch, a pulling sensation, or some mild tingling along the back or outside of the arm. Now this can happen as the nerve begins to glide through areas where it may be tight or restricted. Remember, these sensations, they should stay mild and comfortable and only go to your comfort level. If symptoms significantly increase or travel down the arm, remember, stop the exercise. Similar to the median nerve floss, but a little bit different in the hand placement. So with the radial nerve floss, what you're going to do is you're going to have the palm facing up. So up this way, okay, and facing backwards. So palm up, facing backwards. So we're going to take the palm up, facing backwards. We're going to, again, depress the shoulder down, okay, and we're going to hold that position there. Same thing as the ulnar nerve floss. We're going to bring the arm to the side, and again, right there, I can feel that radial nerve being stretched. And you're going to hold that position. Same technique. We're going to bend the head to the side, bend the head to the other side while we move the hand forward, and we're going to do this motion back and forth, just like that. Okay, that's the radial nerve floss. And again, you can do 10 to 12 reps, 3 to 4 sets, and 5 to 7 minutes in a day. That's really all you need. Okay, really important note though is that when you're doing these exercises, you may have a little bit of increase in that sensation in that nerve pathway. And that's okay, because remember, if you've got a flare-up of that nerve and you're flossing that nerve, it's gonna flare out just a little bit. So you have to be cautious with how much you go, okay? You're gonna feel it, but don't do it too much where you feel too much pain. That's when you gotta stop. Exercise number 3 is the ulnar nerve floss. When the ulnar nerve becomes irritated, symptoms often travel from the neck or the shoulder down the inside of the arm and forearm and into the ring and little fingers. The ulnar nerve floss helps to gently mobilize the ulnar nerve as it travels through the neck, shoulder, arms, and elbow. Now this may help to reduce irritation, improve how the nerve moves through these areas where it may be restricted. While performing this exercise, again, you should feel a mild tingling, some numbness, or a light stretching sensation along the inside of the arm or the ring and little fingers. And again, this can happen as the nerve begins to glide through the areas of adhesions or constrictions. And these sensations, they should remain mild and comfortable. If symptoms significantly increase or travel further down the arm, stop the exercise. So this one's a little bit different. The ulnar nerve runs down the inside of the elbow here, goes down to the pinky finger and the last 2 digits. And the way that we're gonna floss the ulnar nerve is we're gonna do this. We're gonna bring our shoulder and our arm up into a 90-degree angle. We're gonna have palm facing up. We're gonna bring the palm and the fingers to touch the ear as we bend the head towards that area. So this is the position, and you're gonna do the opposite direction with the head. So you're going to bend the head this way as you open up. Okay, so this is the movement in and then out, in and then out. So if you want to increase the amount of flossing in the ulnar nerve, you can extend the arm all the way out and then point the hand down. So again, it's going to be in like this, touch the ear, bend the head, and then bend the head to the other side as you open up and point the fingers down. And again, in and then out all the way down. Okay, in, all the way out and down. Again, 10 to 12 repetitions, 3 to 4 sets, 3 to 5 sets, whatever you want to do, and 5 to 7 minutes throughout the day is all you need. Now that you've finished targeting the main nerves that come from the cervical spine, let's move on to maybe stretching some muscles. Tight muscles in the neck and shoulder can also increase pressure and irritation around these nerves. And exercise number 4 is the upper trapezius stretch. The upper trapezius muscle runs along the side of the neck and across the top of the shoulder. It commonly becomes tight or goes into spasm when there is irritation in the cervical spine. When the upper trapezius tightens, it can contribute to neck stiffness and pain that travels into the top of the shoulder and sometimes into the upper arm. Stretching the upper trapezius may help reduce tension around the neck and decrease some of the pressure around the irritated nerve. And as always, only go to your comfort level. Just like the nerve floss moves, all muscle stretches should feel comfortable and relieving, not painful. During the upper trap stretch, you should feel a gentle pulling sensation along the side of the neck and into the top of the shoulder. If the stretch increases your neck pain or symptoms going down the arm, stop the exercise. Now that we've done all the nerve flossing of all the nerves, the median nerve, the radial nerve, the ulnar nerve, now it's time to stretch the muscle, okay? So the first muscle we're gonna stretch is the upper trapezius. Now this muscle goes up from the neck all the way up into the upper trapezius area. The way that you're gonna stretch this is very important, and there are a couple steps, so follow along. First thing we're gonna do is take the hand and put it on the small of the back. Why do we do that? Because if you don't, what happens, a lot of people do this. Their shoulder's up too high, and you can't stretch when your shoulder's up, so we need to relax the shoulder. So having the hand on the small of the back allows the shoulder to relax. Then you're gonna bend your head to the side, okay? And if that's all you need, perfect. Or you can take the hand and then increase the stretch by pulling just a little bit more, okay? Now, remember, you want to open this area up, so don't have the shoulder hike up like this. You're going to get less of a stretch. So when you do the stretch, I want you to breathe in. So take a deep breath in and then breathe out. When you breathe out, that's when you stretch. The reason for that is when you breathe in, everything tightens up. Your muscles tighten up. When you breathe out, the body relaxes. That's when you stretch, okay? So again, hand behind the small of your back, relax the shoulder, hand on the side of the head, deep breath in, and blow it out, and pull it to the side. Hold that for 15 to 20 seconds. You can do 3 to 4 repetitions, and this one you can do as often as you can throughout the day. For the most part, you're gonna not stretch enough. So I want you to stretch as much as you can. And remember, bilateral. If you're stretching the left side like I was, do the right side. Make sure you're stretching both sides. Now, let's move on to exercise number 5, the levator scapulae stretch. The levator scapulae is another muscle in the neck that commonly becomes tight when you have a pinched nerve or irritation coming from the cervical spine. This muscle runs from the upper part of the shoulder blade to the side of the neck. When it becomes tight, it can contribute to pain along the side of the back of your neck that may travel towards the shoulder blade. Stretching the levator scapulae, the muscle itself, may help reduce tension between the neck and shoulder blade and decrease some of the strain around the cervical spine. During this stretch, you should feel a gentle pulling along the back of the side of the neck that may extend towards the shoulder blade. The stretch should feel comfortable and relieving, not painful. Only go to your comfort level. If the stretch increases your symptoms or pain going down the arm, stop the exercise. So the levator scapulae stretch, very similar to the upper trapezius, just a little bit different in the direction of your head and the pull, the angle of pull. Let me show you. So again, we're going to put the hand small of the back. Now before, remember, we just brought the head to the side. Now what I want you to do is I want you to turn your head 45 degrees, and instead of reaching for the side of your head like we did on the upper trapezius stretch, I want you to reach from the front and reach to the back of your head, okay? So remember, 45 degrees, reach from the front to the back of your head, and then you're going to pull down. Now remember, with the upper trapezius, we pull to the side. This way, I want you to go 45 degrees, deep breath in again, blow it out, and pull it down. Hold that 15 to 20 seconds. Again, you can do, as often as you can. That's the key, as often as you can when it comes to stretching, okay? And do both sides, so important. And as promised, here is your bonus the anterior scalene stretch. Sometimes there can be a combination of a pinched nerve in the neck and additional compression in the area of the brachial plexus, which is in the front of the neck. When the anterior scalene muscles become tight, it can place extra pressure on these nerves as they travel from the neck into the shoulder and arm. Now that's why I included this stretch to help reduce tension in the front of the neck and allow those nerves to move freely. During this stretch, you may feel a gentle pulling sensation along the front of the side of the neck and possibly towards the chest or the shoulder. Now this stretch should feel mild and comfortable. Do not force the movement. And if the stretch increases your neck pain or symptoms going down the arm, stop the exercise. Congratulations if you made it this far, because now you get the bonus stretch. Now this is one of those stretches that not a lot of people do. We don't think to do this type of motion because we're always used to pulling to the side, pulling to the front, and we never remember, hey, we got some muscles here in the front of the neck that are tight, and they're called the anterior scalenes, okay? Now, the way that we stretch the anterior scalene is you're gonna I like to put my hand on my chest here because the action of this hand is gonna be to pull the chest down in this direction, okay? And what we're gonna do with the head is you're gonna bring the head to the side, and then you're gonna look up. So as you're looking up, I like to pull my chest down, okay? So again, deep breath in, blow it out, pull down, and look up. And again, hold that stretch for 10 to 15 seconds, 10 to 30 seconds, of however long you like to get that stretch and to release that muscle. Okay. Now, the important part with the anterior scalene stretch is if you're doing this and it's tight, I mean, you're going to notice right away. Just doing that, it's going to be, wow, that's tight. So only go to your tolerance. As you stretch that muscle, it's going to get looser and looser. Okay. And again, both sides. So if you do this side, I would do the opposite side as well. Okay. Hold it again, 10, 15 seconds, as often as you can throughout the day. Hope that helps. You now have a home exercise routine that may help relieve a pinched nerve in your neck, and sometimes in just a few minutes. Now let me know in the comments which one of these exercises gave you the most relief. Was it the median nerve floss or the radial floss? Drop a comment and let me know. If you found relief from these exercises, like and share this video so it can help others dealing with the same problem. And be sure to subscribe to the channel if you want to discover more tips on how to protect your spine, understand your condition, and learn the treatments that help people get long-term relief. Now, sometimes with the C5, C6 disc bulge, one of the causes could be a pinched nerve in the neck. So the next video that you should watch is this one, where I show you one of the safest and most effective approaches to treating a C5, C6 disc bulge without surgery. Go watch that video next.